Good morning, good afternoon, good evening, everyone. Why am I saying that? It's because you are almost 400 people today that have registered from all around the world. So that's why some of you are from South Africa, others from the US, most of you are from Europe for this webinar presented today by Ron, Dr. Ron Riegel. Hi, Ron, how are you today?
I'm doing well, thank you.
Okay, I can't wait to start with you. So I see that you're all coming in. So welcome to all of you. Thank you very much for joining this webinar today. So it's been the third one already that we've been doing. And I'm going to introduce myself and the company to all of you quickly so you can understand how all of that work. And then we're going to go straight in about 5 minutes to the education. So I'm Remy from Monomedical. Again, good morning, good evening, good afternoon. Welcome to all of you from all around the world. I work for Monomedical. Ron, can you confirm that you see my screen? And you see my,
I do. I see your screen and your webcam. So
okay, very good. So we're a French company and we are specialized in veterinary equipment. We do all kind of equipment, X-ray, ultrasound, endoscopy, laser therapy, etc. And we are trying as much as we can to provide education to our customers. Okay, so we've been doing that for more than 20 years. We are around 20 in France, and we sell all around the world through our distributors. Why am I saying that today? Because if you are from Slovakia, from Portugal, from the US, you can ask or contact your distributors if you have any questions regarding education, regarding equipment. But if you don't, please get in touch with me and I will let you know who is your local distributor if you have any question on the education or the program, the webinar program today, or so questions about equipment. Monomedical is, since the month of July, is part of the group Genia, with a French group also, but they have subsidiaries in Australia, in America, and in Asia also. But so as I was telling you, please feel free to contact me. You see my email on your screen, export@monomedical.com, or you can reach me on my mobile if you have any questions at any time. Okay, so I was telling you we have done 2 webinars with Dr. Riegel already. One in June that was specialized for the equine practice, another one in July. Today, the topic of this webinar is the most important considerations when purchasing a therapy laser. And we're going to have one every 2 months, the next one being in February, integration of laser therapy in your practice, then one in April, using laser therapy as an integral part of your pain management. In April, we have another one, how does laser therapy accelerate wound healing? And the last one will be in September, with the benefits of laser therapy in canine rehabilitation. So all of them will be spoken by Dr. Riegel, and I will never thank Dr. Riegel enough for doing that with us. I'm going to tell you about him now. Maybe most of you know him already. He's the co-founder of the American Institute of Medical Laser Therapy Application. In 2009, he provided education on all types of medical lasers in both veterinary medicine and other healthcare professions. He has authored more than a dozen papers and books on equine anatomy and both equine and companion animal therapy modalities. He was co-editor of the textbook Laser Therapy in Veterinary Medicine Photobiomodulation that I call the Bible. So again, you have here my contact, the email address, the internet address also. Please keep in mind that Dr. Riegel is going to speak now, and at the end, we're going to do a 10 to 15 minutes questions. So if you have questions, please find out the chat box on your screen, and you can start writing your questions right now, and we're going to try to answer them at the end. If we don't have time to answer all your questions at the end, we'll get back to them You can send them by email and we'll try to find the answers for you. Okay? So now I'm going to give Dr. Riegel the access to share his screen, and I'm going to let you with it, Ron. Can you share your screen? Perfect. I can see your screen, Ron.
Okay, perfect. That's what I was going to ask you. Well, welcome everyone. Again, I don't say it as flamboyant as Remy does, but thank you, Remy, for this opportunity to share my knowledge on it. But today, welcome to the most important considerations when you're purchasing a therapy laser. I am Dr. Ron Riegel, as he said, and there are a number of laser therapy units on the market, and I almost weekly get asked by one of our colleagues from somewhere, which therapy laser should I buy? Because there's a lot of different products out there, and you start to do your due diligence on purchasing one, and there's a lot of confusing information. So I'm going to go over in general what you should look at and some criteria you should consider when you're purchasing a therapy laser. So I have a few disclosures to go through here first. Basically, that I am started AIMLA with the sole purpose of educating our colleagues on how to use it. A lot of companies were selling when I started this unit, but nobody started this organization, but not a whole lot of them were concerned too much about education at the time. And I found that a little disconcerting here. And so that's why I'm with that. And again, I was the co-editor and author of 7 chapters in this textbook. And I've published numerous papers and taught. I'm a fellow in the American Society of Laser Medicine and Surgery, which not only includes therapy, but also aesthetic lasers and all the aspects on the human side. I'm a member of the Optical Society and a photobiomodulation board member on there. I serve on several medical and veterinary advisory boards. And again, thank you to Monomedical for allowing me to share this information here. So my personal history with therapy lasers, just to give you a little bit of confidence in what I have to say here. I owned my own practice for more than 25 years, and I was lucky enough to have an employee say, well, I want to join the practice. And I said, well, how about you buy the whole thing? And I started to do other things at that time. They did. So I was lucky. But here's my first therapy laser that I bought in 1979. Now, here's the best part about it. I paid $3,800 US for this laser, which at the current exchange rate turns into 3,358 euros for a 1 milliwatt laser. So in other words, a laser pointer that you use to give lectures is 5 milliwatts. So I spent 3,358 euros for a fifth of a laser pointer. Over the years after that, I was still convinced, even though I didn't find that to be very consistent in clinical results, which we're going to talk about later. Over the years, I tried 10 milliwatt, 20 milliwatt, and then towards the middle of the end of the 80s, beginning of the 90s, we started to see the half watt or 500 milliwatt lasers. And most recently, in the last couple of years, a company has even come out with a 60 watt therapy laser. And that's something right there that I think you need to know what you're doing before you do that, because even in my hand, that was really difficult to use. So around the turn of the century, we had the 5 watt lasers, and then I prototyped the first 13 watt laser. I know 13, where did that come from? That's an odd number. So that's my background in it. So I've not used all the equipment on the market, but I've used probably 60 to 70% of those that are on the market right now. Some of them have been on the market for a long time and have made changes as the technology changed. And some of them have gone by the wayside. You see new companies come and then they disappear after a year or two. So when the first point I'm going to give you is consider the company you're buying for. If it's a solid company that sells, has sold for many years, that's what you want. You don't want a brand new company that just started selling them, because they may fail. And then what do you do to service your unit here? So again, co-founded AIMLA in 2009. So I do get, the first question I get asked a lot of times is, what laser should I buy? And so I turn that around and I ask, first of all, what type of practice do you have? Because each practice is unique in its needs for laser. I mean, there's so much of variation in our patients and everything else. So again, do you have strictly a companion animal practice? Do you have an equine practice? An equine practice, takes more power to reach some of our target tissues. Do you have a mixed animal practice where you have to have the versatility of being able to change the software to do both or many things, even exotics sometimes? Do you have a specialty practice where it's a surgical practice, for example, where most of the uses for the laser will be post-op care, and then maybe possibly including the rehab application, so which we're going to have a webinar for in the future here. And then, of course, we have the exotic applications, which is, you know, everything from scales and feathers to the hide of an elephant. And I have had the opportunity a couple of times to apply laser therapy to an elephant, and it's kind of like lasering a car tire when you see how thick their skin is. So it takes a special technique to be able to accomplish that and get the light to penetrate through to the target tissue. So again, I also asked them, the second question is how many appointments do you see in a day? So is the speed of treatment important to you? Or do you have time to spend half hour, 45 minutes on lasering a patient? But if you're a busy practice and you see appointments every 15, 20 minutes, every half hour or so, you may not have the time or the staff to do that. So that's an important consideration. And are you stationary or are you mobile? I mean, that's a heck of a mobile unit right there. But again, portability, and where that comes into play is, is it easy? Is it light and easy portable? Or is it a great big box like my first laser there that was not as portable and, you know, had some restrictions? And then, of course, how many veterinarians and veterinary technicians, nurses do you have in the practice? I mean, most of the laser therapy administered in the United States, and I think I can safely say from my trips over to Europe and everything, are administered by your technician. Here they're called technicians, and over there nurses, and they are the ones who would actually administer the therapy. So do you have staff? Do you have staff hours to devote to that? So I'm going to give you some ideas here on what's important so that you can address those needs to your practice and kind of, you know, tailor what you're looking for to what your practice is. Let's go back to a few fundamentals first of all, and this will be very quickly, but why add laser therapy to your practice? Why would you consider this? Well, there's basically three major reasons. Number one, you're going to provide a higher quality of care to existing patients, and that's a whole lecture in itself. And it's a healing modality. So that, you know, we're actually stimulating the body to heal. And it's a new approach to many common clinical disorders. And the first one that comes to mind is lick granulomas. Because before, you know, we had all kinds of ways to try to manage these and handle these. And when laser came along, we found out that the higher the dosage you gave, the quicker they resolved and the less likely they were to come back. Most of them still come back, but not as quickly as they did before. We started treating them at 5 joules per square centimeter, and now the common treatment dosage across the world really is 30 joules per square centimeter. So again, so a new approach to that. You know, you're going to attract new patients because your clients are going to get a wow. They're going to see it. They're going to see the results. I mean, I always say, well, how long should I treat them? And I say, well, till you get the wow. I mean, you know, a patient that comes in, you can actually show them right in front of the client. If they're a non-believer, you can show them, you can take an inflamed area like a dermatitis or something and laser it. And you'll actually say, I'll say, look at this, look at the amount of swellings here, how much redness is around the lesion here, or the skin disorder. And I'm going to show you that that's going to reduce some by the time I'm done treating it here in just 20 minutes or so. So that word gets around, and that's still our best marketing tool. And last but not least important is we're going to create a new revenue center that is technician based. You know, you're not going to have to do it yourself as a veterinarian. The technicians love to do it. They take great pride in doing it. And you have a new revenue center for the practice that's not cannibalizing anything else. So in other words, you're still going to do the amount of radiographs, you're still going to do ultrasounds, you're going to do the pharmaceuticals, nutraceuticals, acupuncture, whatever you're doing. And this is in addition to what you're already doing. So it's a new revenue center. And I'm going to touch on that a little bit towards the end there. So what do we get when we apply laser therapy? I mean, it's very simple. You know, you hear a lot of different claims and a lot of different stories, but number one is a relief of pain. You get induced analgesia because of a biochemical cascade of events that happens once you administer a laser therapy. And how long does it last? It depends on the condition, acute, chronic, and of course, the individual patient. I mean, you can't say that, well, you'll be a lot less pain for 24 hours, or it could be 4 hours, it could be 4 days. So it does reduce pain. It's an analgesic effect. Secondly, it modulates the inflammatory response. So in other words, all 4 stages of inflammation are still there. They're all shortened by whatever percentage that individual can do. And so your healing is a lot faster. You basically are speeding those inflammatory stages up so that, basically the body can achieve the most efficient way of healing here. And then of course, a big increase in circulation there. And I've done Doppler ultrasounds before and after I treated, and you could see the vast increase in circulation to the area that was just treated there. And like all physical, all therapy modalities, that is the goal, is to increase circulation to the area so the body heals itself and restore the function here. So it's an acceleration of the healing process, and that's what's always had me passionate about this. I wanted the body to heal itself. I mean, we can give it some help, in other ways and everything, but if I could accelerate it on the fundamental basal levels, that to me was the way to practice. So we all want consistent clinical results, and that's where the choice of equipment comes into play here, because before, even all lasers work, but back in the day when we only had 0.5 watt lasers, 500 milliwatt lasers, it would work on some things, but not others. And as the technology changed, the optics changed, the power changed and everything, we had more consistent results. So dosage has gone up and up over the years. I mean, of course, we started conservatively. You don't want to start high and then think, whoops, that's too much. In fact, I personally don't believe there is too much, but that's another lecture in itself. But you need to provide enough photonic energy to the skin to reach the target tissues. It has to saturate that anatomical area. So it's important to have the dosage. And we're going to talk about that a little bit more here further into the talk here. And administration of this dosage using an effective technique. In other words, do I treat on contact? Do I treat off contact? Do I treat it, from so far away or closer to? Or how do I treat this certain injury? How do I treat this certain wound? And then give the treatments frequently enough to accomplish the treatment goals. This is not something that you can treat just one time. It's not a magic wand. It's a handpiece. So you can treat them, frequently enough, you'll get that goal that you're attaining, which is, either complete restoration or, basically rehabilitation after surgeries, something like that. So I have a little chart here, the penetration parameters. What allows our light from these units to penetrate into the target tissues here to get our consistent clinical results? Wavelength is important. I'm going to tell you all about that in a little bit. Power, again, wavelength determines the depth that the energy will go and the absorbability on the chromophores to have it actually initiate its mode of action. Power determines the number of photons that'll get to the depth the wavelength will take it. Now, I know that's a long, convoluted sentence there, but I'll explain it further as we go. Appropriate dosage, if you're dosing them too light, no different from our pharmaceutical models. If you don't give them a high enough dose of a pharmaceutical product, you don't expect the clinical result that you should get. Appropriate treatment intervals, in other words, how often do you treat them? How many times normally does this disorder take in order to be resolved? And then utilizing proper technique, utilizing, for example, when you treat a joint, I've seen people treat a joint of a canine stifle, and I'll use the stifle a lot because we treat a lot of stifles, but a lot of times the patient will be standing on the table and he's bearing weight on that leg and they're lasering all, circumferentially around the joint. But what they really should be doing is having the dog in lateral recumbency, the patient in lateral recumbency, and be able to not have the dog's blood supply be focused on standing, but have the blood supply focused on gathering around the stifle, and you can put it through passive range of motion. So you're going to get light in further. That's just an example of proper technique. So again, we want to deliver enough photonic energy deep into the tissue. Again, wavelength determines the depth of penetration. And I'm going to not only tell you these things, I'm going to prove it to you here in a little bit. And of course, it has to be the right wavelength for the chromophores, which are mostly copper, believe it or not, that they can be absorbed. Power is the number of photons, that the depth that to saturate those tissues. So in other words, the wavelength takes it this far into it. If I have more power, I'm going to have more photonic energy at that level. And then dosage is basically expressed in joules per square centimeter, and you have to give them appropriate number of treatments and use proper application techniques. Now, let's talk about power first, because, you know, I've been through the gamut of all the different lasers, and I started out with a 1 milliwatt. So my dosage back then, I can't even mathematically tell you what it was. It wasn't very much. It was good to stimulate acupuncture points. That was about it. And it got my kids A's at science fair. That was what that first laser did. But it opened the door for me to consider other things. But I put up a, you know, this is my illustration here, and it's only to make a point. This is not accurate. This is just to make a point that at 980 nanometer wavelength, if the light penetrates this far, if this wavelength, it takes it this far on this patient, where the end of those arrows are, if I have the laser set at 5 watts, I have less photonic energy, less photons at that level than I do if I have it set at 10 watts. So it's a simple concept, again, that you can see right there. Again, now I'm going to prove it to you. So we have a laser here that I put in the palm of this. I had this person put in the palm of their hand. It's not my hand. There's no scars on it or, you know, broke, you know, old fractures or anything. But I put it at a wavelength of 650, 810, and 980, and a continuous emission of energy. And at 1 watt, I'm hoping you can see this. You can see the outline of the hand. This was taken with an infrared camera. At 1 watt, you can see that there's not a whole lot of saturation of the tissue there. And I go to 5 watts, look at the difference. I mean, you can see that that energy is going all the way through my palm and then out on the other side back into the atmosphere, which doesn't do any harm. And you can even see the blood vessels there, and you can see that they're basically a chromophore that we want to get past, because you can see that they're not absorbing the light, or if they were, we wouldn't be able to see them. But that's at 5 watts. And then look what happens at 10 watts. Now we're really saturating the tissue. I mean, there is plenty of energy there for all those. If my target cells were every cell in the palm of my hand, every single one of them would be, every mitochondria there would be receiving a photon. Okay, so that's power. Now, I did a little further on this to show you how power basically supplies deeper the higher the power it is. I mean, whatever the wavelength will take it, but it will provide more photonic energy deeper that you can see it. So I had the opportunity several times to work at some really high-level research labs, and I got the idea from actually in Japan, a professor in Japan who told me that, you know, he was showing me basically how the beam scattered right beneath the surface. So he took a container of water, put powdered milk in it, mixed it up, and it was a light mixture. So you had protein, fat, and carbohydrate in there. And if you put the laser right on top of it, you could easily see the aiming beam scatter all through the first, few centimeters of that milk container. So I came back and decided, well, we're not going to penetrate milk. That's too simple. So I'm going to make tissue. So I mixed it with Knox gelatin and water and milk, which has protein, fat, and carbohydrate. What's missing out of my phantom tissue, of course, is the blood supply and a skin over the top of it, or a dermis area. So this is my phantom tissue, and then what I would do is I would put different lasers on it, different powers, and this has been treated on contact, and then I would measure the beam. Now, this is an illustration here. This is not with an infrared camera. And again, I would measure how far the depth of that beam would go. So here's the results. So this particular laser was on contact. These images were taken with an infrared camera. So every one of these is actually a column of that phantom tissue that I had. And when they're on contact, emitting at CW, when the laser was set at 1 watt, you could only see it on the infrared camera down to 1.12 centimeters. On 3 watts, you could see 3.23, and then on deeper, and we had more saturation of tissue. You can see more energy that's showing up on the infrared image there. As you got up to 12 watts, we went down as far as 20.38 centimeters. So this was not, this was just to illustrate a point again, that we are getting more saturation of the tissue when we use a higher wattage. Why? They're emitting more photons. It's very simple. So again, just to show you the difference here. So here's my phantom tissue, and I sliced it, and I put it into a, hold on a second, I want to move something here. I put it into a tube, and I had my slice of 3 centimeters of tissue in there, and I put the laser on outside the tube, and here's the power meter, which is the image on the left, and you can see that that's going to give me the wattage that it's receiving there on the power meter. I put the tissue in between it, I put the laser there, and I either put it on contact, off contact, or at that distance without the tissue in the middle. And I'm not going to go into a whole bunch of data here, but just to show you, 5 centimeters from the power meter in watts, when the power was 1 watt, when we had no tissue in the middle, we still, because of having to go through the air interface there, we still non-contact, we had 0.97, and on contact, which basically was the same because there was no obstruction in there, was 0.91. So it was basically the average there. So again, when we got down to 15, you could see when there was no obstruction there, we almost got 15 watts to measure on the power meter. Now, when you had tissue there, look how this dropped. So when I'm at 1 power and I'm off contact of my phantom tissue, I only got 0.24 watts show up on the power meter and 0.26 watts when I treat it on contact. And again, we come down to the 15 watt area here, and you can see that non-contact, I had 3.89, I'm having to move my boxes around here, and 3.92 when I was on contact. So you can see, even though when light passes through tissue, you get scattering and everything else. I'm going to go through all that here in a second, but we need to start with enough power on the skin in order to penetrate and have enough power or enough photonic energy at our target. That's basically what this means. So the bottom line with power is you want to get a higher powered laser can always be turned down, but you can't turn a low powered one up. So I can take a 15, even a 20 watt laser and turn it down to a half a watt. But I can't take a 500 milliwatt laser, which is a half a watt, and turn it up to 15 watts. It's just not possible. So you want to get, comes down to versatility. Basically, the bottom line is you don't have to use it on its highest power setting all the time, but it's there if you want it. It's there that you can use it if you want to, and you can always turn it down. And we're going to talk about software and everything else here. But that's basically, the higher power allows more versatile treatments, and with larger patients, and patients with more than one area to treat, you're doing it in an efficient manner. A lot of times when people get a result from laser therapy, they're not getting where they thought they should. In other words, I'm going to use the stifle. I had surgery on the stifle and I lasered the stifle and the dog's almost completely recovered, but it took forever. It'll take less time if I not only laser that stifle that I did surgery on, but his other stifle who's taking all the stress when he's offloading that surgical leg. And then also what a lot of people forget to do is the lumbosacral area, because he's straining his back. So if I laser 3 areas as far as my rehab or post-op treatment, I'm going to gain a lot more. I'm going to basically, number one, provide more pain relief for the patient, and I'm also going to allow them to heal faster and get back to normal function there. So again, we're saturating the tissue. That's what photons do. Now let's talk about wavelengths. For effective penetration, the wavelength needs to avoid scattering, surface absorption, and absorption by unwanted chromophores. What are those? So we basically have a therapeutic window. So for therapy lasers, the job is to get to the target tissue without being absorbed by water, which is the most common thing it's absorbed by, pigment in the skin, hemoglobin, and oxyhemoglobin. Those are our big 3. So basically what we're doing here is we have to have a wavelength somewhere in this window that I've made, either my circle, my ellipse that's on that chart. And I don't have a pointer here. I'm sure I do if I could figure out how to do it here. Maybe that'll do it. So I need to have somewhere in this window right here to basically have it be effective. If it's higher, if my wavelength is higher than that, it's absorbed by water. And I put surgical lasers up there at the top of the chart because there's 10,600 nanometers. Why? We want the water to absorb it because we want the laser to destroy the cells. The beam is actually, the beam is converging to a point, whereas therapy lasers diverge. So they're basically go out in a cone. So that's the difference there. And that's what we want. We want to have, oxyhemoglobin. We don't want it to miss all those things and not have any, complications. We don't want them taken up by water or hemoglobin or the pigment in the skin. And that'll become more important here. So again, just an illustration. Whoops, guess my thing's going to stay there. There we go. Basically, I made another illustration to make a point here that we need depth of penetration dependent by the length of the wavelength, and our therapy wavelengths are between 650 and 1064. There are some lasers out there that have diodes at 1064 that do offer, some therapeutic value and everything, but a lot of times, and 650 again, is down lower here. So 650 would be right at the red there. And you can see that doesn't penetrate near as far as when I get up here to the 800 and 900s. So that's what it should be. You know, we should have a blend of wavelengths at that level here. So scientific evidence, current on the literature, there's no scientific evidence that one wavelength is superior to others. And you're going to hear that claim when you shop around for lasers. They're going to say, we have the best wavelength for cellular stimulation, or we have the best wavelength for wound healing, or things like that. But there's no scientific evidence that one is superior to the other. So your wavelengths, as long as they're in that therapeutic window, that's the important thing, are going to be a wash between all the lasers. Now, if they don't have a wavelength in that scientific, in that therapeutic window, then that's a problem. So some evidence is coming out in the last year and a half that 808, 810 are more versatile. In other words, they treat different, they basically can penetrate more tissue than what 980 is. And again, the higher the wavelength, the deeper it will penetrate. That's basically a physics fact. You probably learned that in physics and at the university level. And the equipment should emit at least 2 wavelengths, and the wavelength in addition to the aiming beam. And that way you get a blend of wavelengths. And we're going to talk about software, how it deals with that blend of wavelengths when we get to the software section. But this is really important. And then, now we're talking about optics. We're talking about, we have the power, we have the wavelengths coming out of the laser. How do we basically take that and administer it to the patient? So your 2 ways of doing that are contact and non-contact, off the tissue or right on the tissue itself. So you should have a variety of handpieces with your laser, and these are Monomedical's handpieces. I think these are really easy to change. They're easy to handle. They're easy to keep very clean, and they have a nice ball head here, which actually, when you're administering on contact with that, you're actually providing a massage on the tissue, and we're going to talk about that a little more here. This is their off contact lens. As you can see, the fiber comes out in the center, and it's recessed back from the edge of that handpiece. And then we have a handpiece here that you can get in all the nooks and crannies in the ear, for example. So they have a lot of specialized handpieces there. So look what kind of handpieces that are available when you're looking at these different lasers, and make sure that they've got, that they're easy to keep clean, that they don't have a problem. They're not, sometimes the balls on some of these things are not very durable, and when they clean them with cleaning solutions, it kind of corrodes the ball, that kind of thing. And I know from using the Monomedical laser that does not happen with this one. So let's talk about non-contact and contact. Why do I keep saying treat them on contact if possible? So this whole slide, this whole part here is based on an N1. There was a 150-pound Caucasian male. I have no idea what his hair coat was, but he was Caucasian. And when they administered the therapy laser to him off contact, they found out that 65 to 70% of the energy coming out of that laser was immediately reflected by the Caucasian skin. When you're in contact, only lost about 5%. So in other words, they put photometers all around. This would be the patient's arm there with the big arrows coming down to it. And they basically measured the amount that was reflected. Now, after it goes through the skin or the dermis, we've got several different density layers of tissue there, and there's going to be some scattering. So I think once the energy gets there, it's pretty much a wash from non-contact to contact. But just think about how much more energy I have to provide non-contact to get it down to the target cells than I do on contact. Now, here's our incidental absorbers: pigment, hemoglobin, and water. And we don't have any idea how much, but it's less absorption with contact because of blanching of the tissue. You're pushing the blood vessels out of there, so there isn't as much hemoglobin and oxyhemoglobin to absorb that. So more apparent, with contact, I'm going to deliver more photonic energy down to the target tissue, and that's not what's not used is transmitted through. So contact and non-contact, that is important. Now, software. Back in the day, we used to have to do it all in our head, figure it out. And I learned very early that 100 square centimeters is the size of about an index card or the palm of your hand. So again, a lot of companies have different software, and we're going to talk about that right now because you need a place to start. And that's what software does. It gives you an idea of where to start. So you pick your species, and then you go through screens asking you certain questions. And I'm going to explain why that is here in a second. But there's a lot of software out there that is very difficult to navigate through. You might have to go through 7 or 8 screens till you finally get to the screen that's going to give you the numbers to start your therapy with. You want to make it easy. And Monomedical here, I know it sounds a little bit like an infomercial here, but I found their software to be very easy to navigate through. So you pick your species, no matter, and they even have settings for exotic, and then it's going to ask you questions. Is it acute? Is it chronic? Whereabouts is it? If it's a musculoskeletal, I've already picked musculoskeletal here for this canine patient. Where is it? In his back is what I have checked there. And the same thing happens for all the species, and they've got different protocols in there for avian as well as reptile and small mammals and the exotic. And then it's finally, after just a few questions, the treatment screen does come up, and that is the screen on the bottom of the slide. And you can see that how much time it's going to take, 270 seconds to administer to this area here. Total energy administered is going to be 1,800 joules. And then you even have the choice of what wavelengths you want to check. Like you can turn the wavelengths on and off. If it's a very light-skinned animal, maybe I want to give it all 980 and not any 808. I can set whatever frequency I want during the pulse stage of admission. I can set it all for continuous wave if I want to do it. And again, it's going to give you a breakdown as it goes through. Now, what if I decide that I start treatment and I want to change it? You can see that circle that says 10.0 watts and it says power underneath it. You can see it. You simply take your finger and move that and you're increasing the power. So it's very easy to manipulate. The other thing on the bottom, you're going to see a floppy disk. I mean, maybe some of you are young enough and don't remember floppy disks, but you can actually store the information for that patient. So when that patient comes back tomorrow, let's just say you have a different employee going to perform the therapy on that patient, they can bring up exactly what you did the day before and duplicate it, which when you go to reevaluate it as the attending veterinarian to it, then you have, that there's been consistent treatment. Are two people going to administer exactly the same? No, but that it's had the same dosage, at what energy, what wavelengths it was administered, at what power it was administered. So if I do initial examination and then after 3 treatments I examine again, I know that the 3 treatments they got were very, very consistent. So that's the advantage to that. So again here, I just wanted to blow this up so you could see it. And again, it'll go through each phase. Right now it's on the pulse phase of this 10 watt administration. And you can see that what the power is being emitted right now, and it'll just keep cycling through this. And in other words, it goes through continuous wave, 3 stages of pulse, and then continuous wave again. And depending on what parameters you put in there is what this will emit. So let's talk about that here on some of the information that you put in. Again, the preset protocols provide a place to start and allow for consistent treatment. That's it. They're a place to start because they were formed. The dosages and everything were, again, you want algorithms for protocols written by people who know what they're doing with a lot of clinical experience, but they're hitting the average. So your patient could be old and chronic. Your patient could be very acute. Now, some software like this one's software does account for that, but some don't. So you basically have to take that in effect. And a lot of times what we're doing is if you don't, you kind of have treated, let's just say you've treated 100 stifles already, and now you have one that's just not responding as well. So you have the ability here to adjust that protocol however you want. And, I get phone calls like that all the time. This case just is not basically, responding like all my other cases did before. And most of the first thing I'll tell you is to hit the button again, because you're probably not giving it a high enough dose. And so you administer twice as long, or at least up 20% or 30% increase, and see how you do. And a lot of times, your software should provide you the ability to do that. So let's go down here and look. I mentioned before that difference between 800 and 900 wavelengths, light versus dark coat. So dark hair and dark skin absorb the higher wavelengths, example 980. So you would have a bay horse, for example. You wouldn't want more 800 or 808 or 810, whatever it is, more than 980. And you have the ability that when dark is selected, the software emits lower wavelengths, emits basically more of the lower wavelengths than it does of the higher ones. So more 810 nanometer than 980. So that's what the software does. It not only governs you about the dosage and everything, it also basically blends the emission that's out there, trying to give you the optimum emission to basically reach your target tissue here. So again, defined by the software, And again, it'll determine what power to start with. Can you increase it? Can you decrease it? Absolutely. What blend of emitted wavelengths are up there? What type of emission, continuous wave versus pulsed, and a suggested dosage to start with. Do you have to follow the recommendations? I don't know. I've been a rule breaker my whole life. So whenever somebody tells me to do something, I'm going to probably do it more or do it less or whatever. But it'll give you, again, a place to start. Do I increase the dose? Maybe after 2 treatments or so. I've found that I've gotten a great response, and I can reduce the dose and reduce the time of treatment here by a little bit. Now, warranty. You might be surprised that this was so high up on my list here right after software, but it comes personally from basically being burned over the years buying equipment. You got to read the warranty really carefully. There's again, how long is the warranty and what exactly is covered? And that again depends on your distributor, the company you're dealing with, and it varies almost per each unit that's out there on the market. So make sure you at least have 1 year of warranty that covers most everything that can happen within reason. I mean, if you leave it on the top of your truck and drive off and it bounces in the driveway, don't expect the warranty to be covered it. But if you have something that just basically stops working for a little bit, you want to make sure that it is covered on the warranty, because repairs to these units can get quite expensive here. Of course, we'd all love a lifetime warranty, but if you're that good a negotiator, I should have had you negotiate for all my equipment. And again, how soon will it be replaced? Ask them that question. So not only do I have a warranty, so let's say I break my fiber, which is one of the weak areas of the laser. 2 weak areas are the handpiece and the fiber. That fiber is all one piece of glass. So let's say I wound it up too tight and I cracked the glass, and now I'm not having any light come out the handpiece. How soon can I get a new fiber? That's an important question. Again, you have patients scheduled. You're going to have to reschedule them. If it takes you a week, that's a lot, somewhat really inconvenient for you. Do they have a loaner program if it's something major? Will they send you a laser in real time? And now, it used to be overnight, but now with all the problems with COVID and the labor shortages, at least that we're experiencing in the United States, overnight's a little difficult. But do they have something that they can ship you to use while your laser is being repaired? And how quickly can you get that loaner? That's important. I mean, a lot of times, let's say you have 8 scheduled today, you went through 4 of them and you broke it. So now you call up and you find out that you can't get it repaired, you can't get the part or whatever is going on with it in within the next 3 or 4 days. Well, all those appointments that you have on the following days have to be rescheduled. So if you have a loaner, that keeps your clients happy, because if they're seeing a response from it and you're not able to provide it, what are they going to do? They're going to go somewhere else where they can get it. Now, engineering, that's a big, broad topic, right? But I'm going to point out a few things that are important here. You can see our little hedgehog over here receiving quite a bit of energy here from a very nice handpiece. Look how comfortable that fits in the hand here. But will the laser emit continuously for long periods of time? The diodes in these things are tested to 30, 40,000 hours of use, and they almost never wear out. Those diodes will outlive your lifetime. But what will happen is if they overheat or they cannot emit for long periods of time, or that it's not engineered properly, they wear out. The heat is what is deleterious to the diodes. So so that's important. How long is the battery life and recharge time? If you're in a mobile practice, where you go house to house, or you go from, you have a large animal mixed practice or a large animal equine practice, for example, how long do I have? Do I have an extra battery that I can, charge one and put one back in, similar to what we do with power tools? Fiber optic cable. This is important because when they first came out, they were not wrapped as well as they are now. And if it's not wrapped properly, it will, basically, if it's not, the wrapping around it is not rigid enough, that is one piece of glass and it will crack. And you'll know it right away because you'll see it on the cable and no light will come out at the end of the handpiece. So it's important to have a nice wrap around there. And also, here's the 2 other things, so that it pivots at the handpiece, that it rotates, because as you move the handpiece around, of course, you're gonna, we don't want this cable end up to being, like an extension cord where you just keep, it forms loops and everything else. Other thing about a cable, is it long enough? Because I was, treating horses' backs, for example. And I didn't want to carry the laser all the time, so I'd set it on the tack trunk. I needed a nice long fiber that I could treat the horse's back and then turn the horse around and treat the other side of his back maybe, and not have to hold the laser all the time. Now, they make pouches and everything to hold the lasers and whatnot, but make sure the cable is long enough, especially if in an exam room, if it's sitting on the counter there, you want to be able to treat all areas of a dog on a table or a cat on a table without having to move the unit itself. And hand pieces, are they well built? I mean, this hand piece that you're seeing in the photo here is about indestructible. It's lightweight in metal. I'm not exactly sure what the metal is, but it's very lightweight, and you know, it can take a bounce and keep on emitting. So, you know, that's what you want. You want to look for that. Training. This is a pet peeve of mine because I feel that that is very important. So who does the initial installation and training? Is it live? Well, that's the old times before our friend COVID came around. Very difficult to do a lot of your installations and training live now. So basically, is it a, you know, live based, or, you know, does somebody get on the Zoom call with you? And I do a lot of this. I have people that buy units, they have some questions, they know they've read the manual, they've watched the videos and everything, and then they need somebody to help them actually how to turn it on and use it. And so that initial installation and training gets you off to the right start. So the company should provide training for you. And again, this varies all over the place, depending on the distributor, depending on the company. So again, what is the availability of retraining when the staff changes? I can't tell you how many technicians that I educated and then fell in love and moved to the southern part of the United States because the weather was better. So you have a new person there and you have to start from scratch again. So how available is retraining? Does the company provide, you know, videos or something to help retrain? Do they offer certification? Actually, I'm working with a university here in the States right now that is going to offer college credits. They've created a department of thermology, and their veterinary division is part of that department. And we are going to have certification programs available there probably by the end of 2022. And our webinars available to keep updated new techniques. Well, Ramey at the beginning told you how many webinars they're going to provide here in 2022. And that's important because you want to be able to know what's new. You don't have time when you're in practice to go look through the literature and, you know, and you go to conferences, and a lot of times the photobiomodulation therapy lectures are few and far between. Customer support, you know, again, that will depend on the area, depend on the distributor, depend on who you're getting it from. Is there somebody that you can contact? And Remy, for example, has sent me a lot of clinical questions, and I answer them in a timely fashion, and he gets it back to there. So I'm kind of at times, and I've done that for several other companies too. So is there customer support being a veterinarian? There's several companies out there that don't have a veterinarian on staff, or even somebody that they can refer cases to. And is there a fee for it? That's important. I have not ever charged it because I think I'm at the stage of my life now where I want to give back to the profession. And technical support, is that available, you know, at a reasonable time? You know, of course, it's not going to be 24/7, and the availability of that support. You know, there's one company out there, this is not an exaggeration, they had only would answer technical support questions on a Friday. I said, what? And they said, yep, that's what we're doing. Okay. Once you get the laser, you want to get it into the practice and you want to get working. You want to feel comfortable with it. In order to do that, integrate it into the practice, you need marketing materials. Does the company or the manufacturer provide clinic education materials, brochures, videos to play in the waiting room, videos to play in the exam room, website materials, templates to what to put on there? In other words, you put it on your website, and do you have some, you know, does the company provide you with a generic few paragraphs that describe to your clients what laser therapy is and what it does, that it does provide analgesia and accelerate healing? Do you have social media templates? I'm not a social media person, but that's a big way to market your practice anymore. That's probably the most, you know, that and the website are the two biggest things. People don't read anymore. So they want to see it on a website. They want to see it on social media. They want to see, you know, a TikTok video made of you lasering a patient in the exam room. And of course, do they help you establish fee schedules? And again, fee schedules are all over the place. Since we're on that right now, you know, it depends on where you are. If you're in a rural area, it's quite different from what you can charge in a metropolitan area. For example, in our area, even in the rural areas of some parts of the state, you can charge more than the rural areas in other parts of the state. And again, that is very variable, and I'm sure that's another lecture, that return on investment's all itself. User references. Will the company you're considering buying from give you a list of current customers to contact, and that's always good because you want to know how your colleagues are doing with it. Is everything they're telling me, are they getting the results that you're expecting from this laser? And then examples of ROI, or return on investment fees, from their current customer base. And I'll tell you what I tell everybody: if you're trying, laser therapy is now, I feel, become standard of care and so versatile. If you can't pay for a unit in a year, you're not trying. My rule of thumb in my practice was, if I couldn't pay for it in a year, I didn't need it. Now, did I follow my rule all the time? No, but that is a true statement, and that is pretty much of a golden rule for any practice. I mean, I've seen people pay off their lasers in 2 or 3 months, and several of them, and then I've seen people that struggled out to a year, but I've hardly ever met somebody that did not pay for it in a year. But you ought to know that. You ought to see what kind of return on investment from their current customer base. Now, this is a biggie because I got burned, so I make this really important. Do you have a good relationship with the sales rep? Are they easy to reach? Because I had a piece of equipment sold to me, and after that thing was sold, you could not find that guy. He disappeared off the face of the earth. And every time I had a problem and I had to send it in, the piece of equipment was over $50,000 US, so basically 40,000 euros. And what happened is that every time it broke, it was another 6,000 Euro US, so another maybe 5,000 euros every time I got it fixed, which was like twice a year. So I'd probably be getting out of prison right now if I could have got my hands on that sales rep, because you don't want a sales rep that's going to make the sale and then disappear, just like I had happen on the screen there. So are they easy to reach and support after the sale? They should be, and most of them are. The sales reps I've met, within the laser field here, a lot of them are very dedicated, and a lot of them believe in the product so much that they want to help you at it. So in review, I mean, I've covered a lot of material here. I've done a information dump on all of you, but just to give you a quick review: power determines the number of photons at the depth that the wavelength will take it, and the higher the power, the more versatile, because you can always turn the big laser down, but when you need to treat several areas, you want to be able to have that power available. And wavelength, they're kind of a wash, but make sure the wavelengths are in the therapeutic window of 650 and then 2 wavelengths above that, below 1064. So in the 800s and 900s usually, 808, 810, 980. Software, is it easy to navigate through? Is it easy to understand? Can you store the patient's data? That's important. Warranty, get the best you can. A lot of times during this time of year, Monomedical may cringe a little bit when I say that, but this is the end of the year, so they want to make their sales numbers. So you can sometimes say, I'll sign this paper today, I'll sign this purchase order if you throw in another 6 months of warranty or another year of warranty or something. References, again, I talked about that. Training, hopefully you can get provided with training. You can go on the AMLA website and get some of it. We have a very good technician and veterinarian continuing education approved course on there. Customer support, find out what that is. Make sure when you look at the unit, it looks durable and looks portable and has a long enough fiber optic cable, and practice integration materials. So I've given you a lot of science today, a lot of facts. The relationship, I think I've made my point there. I've given you a lot of scientific facts, but one we've probably all known since high school is light travels faster than sound. Everybody probably agrees to that. I can't see any of you, but I would like to. Light travels faster than sound, and this is why some people appear bright until you actually hear them speak. So on that note, we'll take some questions now. There is my email if you have a question that's burning. And this is, again, a repeat of Ramey's email at export@monomedical.com. He is kind of the funnel to the pipeline for a lot of questions about the equipment, about, who's you're your local distributor, depending on where you are geographically and all that. So with that said, I want to say thank you before we start the questions, but I want to thank Monomedical again, and I want to thank all of you I'm hoping that my years of trial and error have, made your due diligence a lot easier. So with that, I'm ready for questions.
Thank you. Thank you so much, Ron. Can you hear me properly?
I can hear you fine.
Perfect.
Absolutely.
All right. So thank you very much. That was really, really interesting, especially when you're really in the process of purchasing a laser and you still are questioning yourself and having some hesitation. So that covers a lot of the questions I think But we have a lot of questions. I told you before the start that you could write your questions, and I have many questions, so maybe we're going to try to answer them quickly, because I don't know if we can answer all of them. But in any case, I'm just repeating myself. If we don't have time to answer all your questions, we'll keep the questions and we'll find a way to get back to you and to answer your questions, okay? Again, from everywhere you are around the world, feel free to write to my address email, export@monomedical.com, if you don't know who is your local contact in your country, and if you have any questions regarding education or on the product. Okay, the main question that I had, and I'm going to repeat again, but I wrote also the answer in the chat room, is that you will all get access to the replay. Okay, so some of you just arrived in the middle, so don't worry, we're going to get back to you and give you access to the replay. We have a YouTube channel where you can see already all the past webinars from Ron, and the one from today and the coming ones will be, of course, in the future on our YouTube channel. So feel free to go right away on our YouTube channel if you want to see the past webinars, and we'll send you the access to this one. So one of the questions that I have is for Ron, for sure. Do you have an opinion on thermography, or as a diagnostic technique before laser therapy, or an evaluation technique during a laser therapy protocol?
Okay, that's a question I get quite often, actually. And you always want to do laser therapy when you have a definitive diagnosis. I mean, that's everybody's dream every day, to get a definitive diagnosis on everything. What stops us from doing that is the phrase, "How much does that cost, doc?" So we'd love to have a definitive diagnosis and know exactly what we're treating, but often we don't. So I think the second part of that question is really relevant here. So I have a dog that I'm pretty sure is off, or let's just say a musculoskeletal problem. We'll make it really easy. And I know that this one area is a problem, and I treat him, and after, I always say better in 4, or treat him no more, or look further. And if they're not better after, you should see an improvement really after the first couple of treatments. And if you're not seeing it, you're number one, we're probably not getting light deep enough into the tissue, or number two, we're pointing it at the wrong place. So you should reevaluate. So that helps you, eliminate some. Does that happen very often? No. But again, I can't stress enough that we don't laser enough sites. If I put a stone in your shoe and make you walk around in it all day, where will you hurt? Sure, the bottom of your foot. If I only lasered that, you wouldn't recover as fast as if I'd laser the bottom of your foot, your calf, your hip, your lower back, and even maybe your shoulder. So that's the difference. And so I'm treating the animal holistically. I'm treating the entire patient. Now, as far as if it does not work and you're not getting the results, look further. That means there's maybe something else going on, or another secondary compensatory lameness somewhere that you need to address too, in order to get complete recovery. So I hope that answers that.
Okay, thanks. How much reflection and scattering in colored skin patients? Does it require trichotomy?
Okay, so again, I understand how much reflection is on, I gave the Caucasian example there, how much reflection is on a bay horse, for example, that has a dark dermis and dark hair. Very little reflection if the wavelengths are in the therapeutic window, because 980 is absorbed by dark colors. So a lot of that, gets taken up by the color of the tissue there. So there's not a whole lot of reflection. The reflection that bothers me every once in a while is a safety factor, because people I see lasering with jewelry on, and when that beam, if it would happen to hit like the band on your wristwatch, it basically reflects everywhere. So everybody needs to wear eye protection. But you don't, when you're on contact, you really don't get hardly any reflection on, no matter what the color of the skin, or whether it's feathers, or whether it's scales, or or it's hair, whatever. But off contact, depending on that, the skins that have pigment in them are not going to reflect as much as the light skin, like a gray horse, for example. You would always want to treat a gray horse on contact. You get the most energy out of it, if they'll stand it. And basically, when other dermises, when they have color on them, you just don't have that much reflection.
Okay, very well. Does software block emission when time of program treatment is reached?
Could you repeat that again? I might have not
Sure.
quite understood it.
The question is, do the software block emission when time of program treatment is reached?
So if I'm understanding that correctly, when the software will actually stop the treatment, it'll stop going through the cycles when the goal of when the energy is all delivered. So it automatically shuts off. That's almost true of any software. But I don't. That's how I'm interpreting that question. So if I don't give a good answer here, email me or email Remy there, and we will get a good answer for you. So the software governs a lot of things. So go ahead.
Okay. I have a question. Do you think the Monomedical laser will be a good addition to my practice? Because sometimes we see competitors providing 20 watts of lasers or more. So is like the bigger the better, or we don't need that much energy, that much power?
That is a good question. Monomedical's laser provides a way to treat equine as well as small animal. If you have a companion animal practice, I can't think of anything that you couldn't efficiently treat with that. When you just go up 5 watts, even 10 watts, you're not saving a whole lot of time. 15 watts is, the way they have everything set up here is very easy to use. The higher power I've used, I'll tell you honestly right now, do not get a 30 watt laser. I mean, 30 watts is the bottom of our surgical laser powers. And unless you have a lot of experience with it, you will singe some hair, believe me. And like I said, I had that 60 watt laser handpiece in my hand, and I can pretty much tell the wattage by putting it on my forearm, and I immediately moved it as soon as they turned it on, and my hair immediately disappeared. So you're not going to burn anything with it unless they're under anesthesia and you suffer from narcolepsy, but you will have a very versatile laser with the Monomedical laser. Yes, there's other lasers out there that are stronger, but you're just not gonna, it's like a car. My truck can go over 100 miles an hour. How often do I use that horsepower? I don't. I'm usually going the speed limit, which in this country is, I should say 60 kilometers an hour, but somewhere down below that. So you don't have to turn it on max all the time. And I know there's a lot of people that say that that's how I get the best results, but this laser here is very portable, and again, the software is easy, and I think the power is there to give you really good treatments. Of course, you'd love to have a 25 watt laser if I'm treating that elephant, but to treat, equine or small animal or even some, pets, goats, sheep, and exotic animals, you've got plenty of power here in the 15 watt laser.
Okay, thank you. I'm sorry, but we're going to take, I'm going to ask maybe 2 or 3 more questions maximum because it's already past time. So the next question is, what will be your average cost? Or how much would you charge for an application?
That's a fair question. Again, that depends on what geographical area you're in. I mean, if you're in a rural area, it's going to be different from a metropolitan area. And I touched on that basically. Let's give you some figures here. And I can honestly say in the States, I'm not familiar with the fee schedules other than a couple of places in Europe. And I would say between 40 and 45 euros is the cost of treating one site on a companion animal. Now, sometimes if you have to treat 2 sites, like my 2 stifles and back deal, they only increase the fee 20% or something like that. But that would be my base fee. And that's usually across the board. There's some that are less, some that are more. I mean, I've seen people charge a lot more than that. In the equine area, I mean, I'd say 60 to 70 euros is a normal fee to treat one area, because usually when you're treating one area, you're never treating one area in the horse. If you're treating a carpus, you're treating both of them. You're not just treating one. So usually the base fee is around 60, 70 euros, somewhere in there, even down to 50 probably. But I tell you, honestly, when I would treat a back, it would cost, let's see, 240 euros was my charge way back when, just to do one back, one time. So, and it was well worth it because you could have the owners check it and see that and feel the difference the next day.
Okay. Again, we're going to go with one more question, but please write my email address somewhere, export@monomedical.com. I will find a way to get the answers for you. One more question, Ron. Do you have protocols to work also on visceral problems? I don't know if you say visceral, V-I-S-C-E-R-A-L, visceral. I don't know if that's pronounced correctly.
Yes, and depends on your definition of that. In this country, I mean, are there protocols in there for treating renal problems? Are there protocols in there for treating respiratory problems? Yes. Then, and honestly, it doesn't take too much extrapolation from what is in the software to be able to do that. I mean, you'll be surprised how versatile this is. We didn't go into the versatility here, but if you're not treating urinary problems in the cat with this, if you're not treating urinary problems in the dog, or kidney failure, or renal failure in cats, which is very common in this country, we overfeed everything. But you know, those protocols are easy to come by and can be done. The software doesn't restrict you to the software. There's also manual settings, which I probably neglected to say during the lecture. So that is a good question, because it made you say that. So once you find out the protocol, you can put it in there. But yes, absolutely. There's a hint of those in there, but you can extrapolate easily to get those in there.
Okay. Well, thank you very much, Ron. We're going to finish there. There are many questions, many more questions. So please send them to me at expo.
Remy, if you send them to me, I'll try to get them answered today. I actually have no Zoom meetings here for the next few hours, and I know we won't get them to me in a few hours, but by tomorrow, I'll try to answer all the questions that they have, okay?
Wow, that's super nice. Thank you so much. So you all hear that. Please, if you want to answer by today, you can write to the email address above on your screen, Ron's email address. Thank you again to all of you. Thank you, Ron, so much. Every time I'm saying it, but you've been wonderful. This is so interesting every time. We are just drinking everything that you're saying. It's amazing. And thank you to all of you for participating. And please stay up to date, because there are going to be some more education for you. And that's it. Thank you to all the distributors that have shared the information and asked us also. You will also receive the information for the replay. You want to say anything, Ron? Thank you so much.
Nope. Just thank you all. And honestly, I enjoy sharing what I learned. It took me a long time to realize some of the things that I told you today. And I'm just more than happy to help my colleagues, because we're helping all the animals that way. So that's my feeling about that. So thank you.
That's what we all want to do. The animal health is the most important. Thank you so much. Bye-bye.
Bye.